Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Marigal Medical. Physical medicine, regenerative medicine, medical weight loss, neuropathy. We got a lot of treatment options here at our clinic. We thought today would be a good idea just to summarize all of the exciting treatment options that our patients have available to them right here in our clinic in Leominster. It's going to be some great information, so stay tuned. Well, Dr. Mike, we had a great success last night with our medical weight loss program, just continuing to educate the public on this exciting new treatment option that we have in our clinic. And I thought that this week would be a good idea, since we're talking about a lot of new services, including our neuropathy program, that we just kind of summarize some of the treatment options that we have at our clinic. So, first off, the foundation of the clinic, this is an integrated physical medicine clinic where we've combined medical care, physical therapy, and chiropractic treatment under one roof. And for our patients, there's a lot of great treatment options just right there.
Yeah, I think the first and simple thing would be is to have you understand what physical medicine is. So my training in physical medicine and rehabilitation, which is the name of the specialty, short is the word physiatry, if you've heard that word before. It really incorporates a functional approach to getting people back, restoring their activities and life events. So we think about the neurological aspects and impairments. That's why we think about neuropathy issues. We think about the functional aspects of mechanical things, the joint pains, the back pains, the knee arthritis and things like that, getting the person going back to work and things. That's the more physical, classic physical medicine component. And then we think about the rehabilitation model, getting a person restored with physical therapy activities, getting their weight down so they can increase their exercises. So there's a lot of incorporating the aspects of physical medicine as a specialty. We look at this whole aspects of looking at you from a diagnostic perspective and putting it together to say, we can order tests, we can do standard musculoskeletal evaluations, we can do neurological evaluations, and then we can put it together with our full team to actually look to see restoring your function.
Yeah, it's fantastic. On the chiropractic end, be celebrating my 26th year in practice, and Dr. David Sherman and Dr. Rebecca Brooks are outstanding chiropractors. We've got some interesting technology where we're one of the few clinics in the region that utilizes both cervical and lumbar decompression, which is a great treatment option, which provides gentle traction for those patients where a regular chiropractic adjustment may not be an option for them. And on the physical therapy side, well, that's my wife's expertise. Colleen is our physical therapist, and she gets to utilize this fancy robotics technology called Hanova to really give our patients a great specific treatment protocol where we can track their objective improvements and give a little bit of a twist on standard physical therapy. For those patients that are suffering from arthritis or degenerative conditions, or where they have an injury where maybe there's a partial ligament or tendon tear, we're now still one of the few clinics that has regenerative medicine options in our clinic. And when we talk about regenerative medicine, I always like to tell patients there's really two options. We have our Wharton's jelly allograft injections, and then our PRP injections. And what's the difference between the two?
Yeah, so PRP stands for platelet-rich plasma. So that's when we take a person's blood supply out. So we take a small sample of their blood, spin it down to take the cells away, like the red cells, the white cells, and get that plasma level. That's where all the growth proteins, that's where a lot of the restorative aspects of recruiting the body's ability to heal wounds or heal injuries. And we re-inject that into a location of which is damaged. You have like a rotator cuff tendinopathy or a breakdown of your tendons. If you have some cartilage damage in relation to your knee arthritis or the muscles of your back, so we can inject into those spaces with the plasma. The regenerative medicines, or the Wharton's jelly, is harvested from umbilical cord of a donated placenta, right? So we take that as now we're using a human body, again, relative to donated placental tissue, which is again the Wharton's jelly, and injecting that into that damaged area, again, such as maybe your rotator cuff or so. And we're trying to get those particles, those aspects of the cellular connections to the person who's getting the injection to enhance the healing properties. And so that's just why we call it regenerative medicine, or I like to say reparative medicine. We're enhancing the body to repair damaged tissue. And that's where we thought about the regenerative aspects in a physical medicine process. We evaluate your shoulder, your knee, your back, we find the problem, and then we have that great option, which is not classically surgical, it's not a lot of medication, it's just an injection that's innovative and newer that can help out a lot.
Yeah, it gets the root cause of the problem, and oftentimes we'll combine the Wharton's jelly with the PRP.
Right.
PRP exclusively, we usually dedicate to more if it's just a soft tissue injury and if it's a younger patient. So my son Ainsley is a great example of how we use PRP to accelerate a healing fracture in his foot. Generally speaking, most of the patients benefit from the combination of the two, where we use the Wharton's jelly to help with that repair initially, and then the PRP with the growth factors helps to boost the injection, making the injection last as long as possible. And what we're seeing is a bulk of our patients are still doing well anywhere from 1 to 6.5 years after their initial injection. And we've got a lot of patient data. We're closing in on 1,300 injections. We're at 1,265 as of yesterday. So a lot of data to support it. NutriHealth, lifestyle medicine. So that's our medical weight loss arm. This is something, and we had some great attendance last night talking about, how our patients can benefit from a whole food-based nutrition program where the first step is medical weight loss. So the difference being there's medical supervision, but we're not relying on boxed food or counting calories. This is all natural, and boy, we're seeing fantastic results so far.
We are, and I always like to say we're trying to minimize, again, procedures like, again, medications and surgeries, so we use food as medicine.
Yeah.
So that's our goal for a person who has obesity or is overweight. The concept of we can make your food work for you and learn that in a lifestyle manner, so we know and teach a little bit of the education of what foods do what for our nutrition. But if you think about that person who's overweight, they're the person who might have back pain and might have, joint pain and things. So it incorporates really important model of making the injections better, making the physical medicine better, because we need to work on your physical function. If you're overweight, you're not moving very well, we want to get that down too. So it's really a more comprehensive approach, because that person is need to reduce the inflammation in their body, which a lot of fat and adipose tissue results in inflammatory activity. So we address the weight component, then food as medicine, keep you away from a lot of medications, and we're on track to actually improve 2 things or 3 things at the same time, because again, that's so important to do, to get it for a functional perspective.
Yeah, and then finally, all those patients out there that are suffering from neuropathy, we've got great news for you. We have an FDA-approved treatment option that's covered by insurance that you definitely want to get more information about. The treatment is called Neurogenx. It's a combination of high-intensity electric stimulation accompanied by a nerve block, and the diagnostic component on how we establish whether or not the patient qualifies, that's called TM Flow. So we did a couple of videos on that already, but it's great to kind of summarize. We're really excited about this option in addition to everything else that we have at the clinic.
Yeah, so it's our newest program, and I think for the people who have suffered from nerve issues that go along with all these problems that they might have. So when you don't have input to your feet, if you, again, we need our balance machine and again, our robotics machine to test their balance, you're not getting good perception for a person who might be diabetic and have neuropathy, person who's had damaged nerves because of their bad back, or have cancer-related or chemotherapy-related nerve damage. You lose your balance. When you lose your balance, all those functional things fall apart, and your ability to test your position sense and all these activities that might be more difficult. By applying this new device that we have, we can stimulate the nerve and also enhance the vasculature component to help healing again into the tissues of the limbs. Again, primarily looking at legs, but it could really be applied to many areas. Currently, we're focusing on the lower extremities to get that strength and balance and walking, etc., back in store. And by doing so, we can reduce pain, we can reduce the numbness and tingling, and eventually will help improve your function because you're walking better, more comfortable, you can participate in therapy more, you can do your exercises better, that's where it's, again, going to be really exciting to have this new device.
Especially for the patients that are diagnosed with diabetes, that diabetic peripheral neuropathy. We're seeing great results with that, and you definitely want to check us out on the web for more information. You can always go to our website, and that's at maragonmedical.com, a wealth of information there. And definitely consider subscribing to our YouTube channel. So my son informed me that we hit 1,000 members. That's a big accomplishment when Ainsley and Kylie were their initial subscribers. So we're up to 1,000 members. Subscribe to our YouTube channel. We update those videos on a regular basis with all of the exciting treatment options here at Maragon Medical. And best part, we take most insurances. Well, that's it for today. I hope you learned something. Have a great day, everybody.
Bye now.